Hello, guys. Welcome back to our channel. Today, we're going to dive into an important topic, shedding light on Dexona Injection. It's crucial to understand its uses, dosage, and potential side effects. So, let's get started. Dexona Injection is a powerful corticosteroid that finds application in treating a spectrum of inflammatory and immune-mediated conditions. Rheumatoid arthritis and other autoimmune disorders often benefit from Dexona's ability to suppress overactive immune responses. Skin disorders, such as severe eczema or psoriasis, may see improvement with Dexona. It's also employed in managing acute asthma attacks. In certain cases, Dexona proves effective in alleviating symptoms of various allergic reactions, ranging from hay fever to severe allergic rhinitis. Furthermore, Dexona is sometimes used in hematological disorders like thrombocytopenia, where it aids in raising platelet counts. Additionally, Dexona might be considered in some cases of certain cancers as part of supportive care, mitigating inflammation and edema. While Dexona Injection offers therapeutic benefits, there are instances where its use is contraindicated. Individuals with systemic fungal infections should avoid Dexona, as it can exacerbate these conditions. Similarly, viral infections, especially herpes simplex, demand caution due to the potential for worsening. Dexona is not recommended for those with a history of hypersensitivity to corticosteroids or any of its components. Conditions like tuberculosis, peptic ulcers, and diabetes require careful consideration, and the use of Dexona might not be advisable in certain cases. Always consult with your healthcare provider to determine if Dexona is suitable for your specific medical condition. Now, let's delve into the dosage details for Dexona Injection. The appropriate dosage can vary based on the specific medical condition being treated, the patient's overall health, and other factors. Dexona is typically administered as an intramuscular or intravenous injection, and the dose is measured in milligrams. The typical starting dose may range from 2 to 4 milligrams, and the frequency of administration also depends on the severity of the condition and the healthcare provider's recommendations. It's crucial to strictly adhere to the prescribed dosage and schedule to ensure the safe and effective use of Dexona. Your healthcare provider will determine the precise dosage that aligns with your medical needs. The typical frequency of administration may vary but commonly ranges from once a day to several times a week, as directed by your healthcare professional. As with many medications, Dexona Injection may cause side effects. Common ones include increased appetite, weight gain, and changes in mood. However, more serious side effects can occur, such as high blood pressure, vision problems, and gastrointestinal issues. If you experience any concerning side effects, contact your healthcare provider immediately. A few important warnings come with Dexona. Prolonged use can lead to adrenal suppression, a condition where the adrenal glands don't produce enough natural steroids. Abruptly stopping the medication can also be risky, requiring a gradual tapering under medical supervision. That concludes our overview of Dexona Injection. Remember, this video is for informational purposes only and not a substitute for professional medical advice. If you found this video helpful, please give it a thumbs up and consider subscribing for more healthcare insights. As always, stay informed, stay healthy. Until next time.